My name is Dr. Muhammad Adila. I'm a surgical oncologist that works in Hadassah Medical Center. I was trained in my residency in Hadassah Medical Center, and then I did my fellowship in the USA at Memorial Sloan Kettering Cancer Center. I'm specialized in treating metastatic lesions either in the abdominal cavity or the liver. And I'm going to talk to you today about this technology that I learned being at Memorial Sloan Kettering and brought back with me to Hadassah Medical Center. And now we're currently the first center that is doing these surgeries in the whole Middle East and part of Europe. Just before we go to that technology, I'm going to tell you a few statistics about liver cancer, and I'm talking about metastasizing liver lesions from the colon to the liver. When the tumors go from the colon to the liver, sadly around 50 and 60% of patients that have primary colonic tumors at once in their time life will the tumors will spread to the liver. And sadly, most of these patients are deemed unresectable when the diagnosis is made, and most of them cannot go into surgery, and their prognosis is not great even with the best systemic therapy, chemotherapy that they get throughout their IV or ports. This old and new technology I'm going to talk to you about is technology that has been evolving for a while in the USA in Memorial Sloan Kettering Cancer Center, where I trained, and it's now spreading in the United States, and almost 50 centers in the States are doing these procedures right now. But we are here in Hadassah, the only center that is doing it outside the United States with the same efficacy and the same quality. We are utilizing what is called the hepatic artery infusion pumps to treat patients with metastatizing tumors to the liver. This treatment is based on two facts that are very easy to comprehend. The first fact that most of the blood supply of the liver comes through the veins, not the arteries, whereas the tumors in the liver get supply from the arteries of the liver rather than the veins. The other interesting fact is that the drug we use to fill the pump and give to the liver gets digested mainly by the liver at more than 90%, which allows us to give way high concentrations to the liver and target the tumor lesions more efficiently, causing them to disappear or respond pretty efficiently. So this pump is basically working on gas called Freon, and this gas works on the body temperature, pressurizes the chemotherapy that we put in the pump, and it goes throughout this catheter that we implant surgically into the arteries of the liver. It's implanted here, and it goes through the arteries to the liver underneath the skin, so we can every time fill it back again and give more and more chemotherapy for the patients. This goes together with systemic therapy, the chemotherapy that patients get in the IV or in the port, and together the damage to tumor cells is way more enhanced and much better. Because of this kind of therapy, we know now that almost 50% of the patients, or even more than 50% of the patients that get treated with this pump, although deemed unresectable at the beginning by their treating oncologists and surgeons, because they have so many tumors in their liver, on both sides of the liver, and there is no way to go and resect them, now they can, with the use of this pump and this kind of therapy, get to total resection of their liver tumors by decreasing the sizes of these tumors efficiently by using the pump. Furthermore, the beauty of this pump is not only to use it in what we call before surgery, it's also very efficient in preventing recurrence of tumors. So in patients, even if they are resectable or can take out the tumors of their lungs in both sides, a lot of them, more than 50–60%, will come back with tumors in the liver. When I use this pump and I take the tumors out, it prevents the recurrence of tumors to the liver, and allows for sustained recovery and cure of these patients. In both of these situations, this pump is very efficient, and as I said before, it's used together with systemic therapy given by the treating oncologist to achieve the best results ever. I want to denote again that this is the only FDA-approved pump. This is the only FDA-approved pump, and we are the only center right now using it outside of the United States to deliver the special chemotherapy treatment. And it is a great hope for patients with metastasizing disease to the liver. It's an old treatment, but it proved its efficacy and utility in these situations. We advise you and encourage you to contact us for any inquiries about this kind of treatment and see if it suits you for your disease. And we hope that you will recover fully and get cured from your tumors or metastases. Thank you.